The topic is kidney disease and hypertension among African Americans and other parts of the population. And we're talking to Dr. Faulkner from Meharry Medical College. Dr. Faulkner, what we'd like to do during the last segment is to give you an opportunity to give our audience some information relative to hypertension and some of the other things that you think that they ought to know in order that they might be able to perhaps assume responsibility for their own health.
Well, the main thing is keeping your blood pressure under control. 120/80 blood pressure seems to be the target that we would like to have every patient who has high blood pressure reach. Another thing is watch your diet, cut back on your salt, and most of all, exercise. Get your weight down, keep it down. But exercise seems to be a very good indicator of decreasing the risk of worsening high blood pressure and decreasing the risk of kidney disease.
And so there are some things that individuals can do if, now you mentioned this whole aspect of diet. What are some of the things that you would encourage those individuals to try to stay away from as much as possible?
Well, you know, salted pork is a main thing, bacon, ham, those things. Pork is not salted is pretty good, like pork roast. We want you to stay away from a lot of things like potato chips, all those knickknacks that you like to eat before you go to bed. Those things have lots of salt in them. They're no good for you.
And so you would encourage people to sort of be careful in terms of not only what they eat, but their snacks as well.
Yes,
very good.
Yes.
Now, we talked about, I think, earlier about the prevalence of childhood obesity. Now, does that is that a problem in internal medicine? And if so, exactly what are some of the problems that we generally associate with childhood obesity that really occurs or shows up in what you're doing?
Well, childhood obesity is a major problem because children are getting bigger and bigger and bigger. And of course, by the time they reach an internal medicine age, which is 18 and older, we already have lots of problems we have to deal with. You know, they might have diabetes by the time they reach adulthood at 18. They might be having some heart problems at that time. Certainly, they might be having problems with asthma and so forth. So many problems can occur, and as well as high blood pressure, because you know that the bigger you are, the fatter you are, the more likelihood of your blood pressure becoming elevated. So it creates lots of problems. Obesity, arthritis is a major problem that people are having, back pain, knee pain. It's just a humongous problem that we're having with obesity these days.
And all those are generally, you can generally associate all those with obesity.
Yes, you can.
And now, I would imagine that Meharry has a number of programs that people might become involved in that could sort of give them additional education in reference to what they have to do in order to deal with this as an issue.
Yes, they can call the Clinical Research Center at Meharry Medical College and see what's going on there, what studies are already been implemented, what studies are coming down the pike that deal with obesity, high blood pressure, and diabetes.
And so when you say, you talk about studies, I understand that there's what they call trials.
Yes.
And do you often have trials in terms of trying to deal with that, and perhaps there might be some of our audience, members of our audience, who might fit into some of these categories that might, you know, that you might talk to this morning?
We have lots of trials going on at Meharry Medical College. We have trials going on in internal medicine, trials going on in the OBGYN department, trials going on in family medicine, trials going on in nutrition. So yes, we were looking forward to people calling in, seeing what we have available, and if they are able to fit into one of the trials, to come on and join us. Myself, I have the SHARP study, which is the study of heart disease and looking at renal disease.
Now, what the SHARP study, explain that.
Well, it's a study looking at, SHARP is the study of hypertension and renal protection. And what it is, it's a study looking at patients who have hypertension with some renal disease and seeing if we can give them a lipid-lowering agent or an agent that absorbs lipids, or decreased absorption of lipids, I'm sorry, giving them that agent and seeing if their renal disease as well as prevention of heart disease occurs.
And you do need individuals to volunteer for such a trial?
Yes, yes. We need people who who can volunteer for that. And we'd like for them to call us at 327-6007 in the Clinical Research Center and let us bring you in, let us draw your blood, see if you meet the criteria, and we'd be happy to, if you meet the criteria, bring you into the study.
What would be the criteria, not of this particular trial? I mean, an individual who might be watching this morning might have some of the problems that we would generally associate with this. What could you tell them in terms of the criteria that they would have to meet in order to become a part of this trial? And I also understand that in many instances the medication and transportation and things that are generally associated with these trials is generally free. Well, you want to explain how that works?
The transportation will be free. The medication that we give you, yes, it will be free. And what we would like for you to do is have hypertension, and if you have renal disease, that will take you through the first screening of the study. If you require a lipid-lowering agent, though, that may eliminate you from the study if you require it, because some patients will be randomized to a part of the study that says you get the agent, the other says you won't get the agent. So if you require the agent, then we would not like to have you in the study because you will need it and we wouldn't know which arm you went into.
You know, Dr. Faulkner, I think that speaking of these trials, and I think the last time you were with us, you talked about why many African Americans were perhaps apprehensive to become involved in some of these trials and donate organs and et cetera and et cetera. Why don't you sort of repeat some of that information in reference to why African Americans, and I think at one time you did a study that indicated that African Americans are reluctant to become involved with organ donations and et cetera. So why don't, during the last 3 minutes, why don't you sort of give us that kind of information?
Well, as it related to organ donation, yes, people were reluctant to donate because they felt that someone would take their kidneys if they had not died but were in a coma and may come out of the coma, and they would be sort of left to die if they had signed their organ donation card. So they were reluctant to do that. And then the families were reluctant to give up organs because they said, well, if I bury my relative, they won't have their organs, and we just don't want to do that. We've been educating people and still educating people about this, and people are now a little more freer about signing their organ donor card than they have been in the past. But of course it takes time, it takes education, and of course it takes experience for people to say, yes, these things are not happening, and, you know, and to discuss this with their relatives as generations go down generations. You know, people become more trustworthy of their physicians and people around them and hospital staff.
And of course you still maintain that in spite of the fact that there's such a high percentage of African Americans on dialysis, that there are still a very, very small number of African American donations. Speak to that.
Yes, there are. I think African Americans now donate maybe about 12 to 15% of organs that are donated. But so many African Americans are coming up with diabetes and high blood pressure and all these other things that prevent them from donating. That sometimes they're afraid that even if they donate early, they might end up with one of those problems and end up on dialysis themselves. And that is something that we have to deal with. But people are not as afraid of as they have been in the past about donating organs.
And so, Dr. Faulkner, you think that overall that there has been some progress made in these areas? Because I think the last time there was a very, very pessimistic kind of attitude that many people had throughout the nation in reference to organ donations. Now, is your mentor, I think, in Washington, D.C., is he still involved? Dr. Kellner,
yes,
is he still involved? And why don't you give us, over the last half minute, a report on what he's doing now?
Oh, Dr. Kellner is still heavily involved. But of course, he's chairman of the Department of Surgery at Howard University now, and so we don't hear from him as much as we used to hear from him. He has a national program, the MOTEP, that they're still working with. And so he's still very much active, actively involved, but a little more in administration these days.
Very good. And of course, Dr. Faulkner, over the last half minute here, let me simply thank you for bringing that information by, and again, simply telling us that the fighters and the warriors are still out doing the same thing that they've been doing for the last many, many years. And of course, that's what they'll continue to do. And we certainly appreciate you, and we recognize you as one of those warriors dealing with this. And of course, let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you, and good morning.